after the arterial system has distributed blood to all tissues of the body all over, the tissues have used this good oxygenated nutrient blood, and the blood that is less useful, the venous blood, needs to return to the heart, to go to the lungs, to be reoxygenated again. This system of returning blood from tissues is the venous system. Now, we have seen this capillary bed when we talked about the arterial system, and this is the end of the story of the arterial system, and it is the beginning of the venous system. Now, this capillary bed connects the arterial system with the venous system, and the part of the capillary bed to your left is red colored, and it is the arterial side of the capillaries, but on your right it is the venous side of the capillaries. Now, this deoxygenated blood is going to merge away from the capillary bed, and it enters a venule, and then this venule is getting gradually larger and larger until it reaches the right side of the heart. When the arterial blood was distributed all over the body, there was a pump behind it, that is the left ventricle, which is going to pump the blood to all parts of the body. When we come to the capillary bed and the process of diffusion happens and deoxygenated blood starts to enter the venules, there is no specific pump that is going to send this venous blood to the heart, but instead we have veins inside muscles, and when muscles contract, they push the venous blood up to the heart. Now, this pushing up is important, and the next most important thing is that veins have valves. Valves are made from the tunica intima, and they prevent backflow of blood to the capillary bed or to the lower parts of the body. Veins have valves. What are they made of? They are made of the tunica intima. That means they are made of two layers of endothelium plus little connective tissue in between these two layers. And these valves are what? They are one-way valves. They allow blood to go towards the heart, and they don't allow blood to come in an unphysiological direction. And when the muscles contract, they compress veins, and the blood will go up, and the valves will be stuck to the wall of the vein. But when muscles, they do not contract, blood tries to come back, and when it comes back, it fills the spaces or the sinuses of these valves, and the valves will close, preventing the backflow of blood. Valves are important for the venous system. In this figure to your left, the blood is being pushed up by the contraction of the muscles compressing the veins. That is very physiological situation. Now in the middle figure, when muscles are not contracting, the blood tries its best to come down, but the valves will prevent this backflow by filling the sinuses between the valve and the wall of the vein. Sometimes these valves, they are not functioning well for many reasons, and the blood, when the muscles are not contracting, the blood will come down. This is because the valves are not efficient because of diseases. When valves are alright, the veins, they are straight and nice. When the valves are not working, the blood comes down and the veins will dilate as a first stage, and then they become tortuous, and this is going to increase largely the size of the veins. Therefore, what can we conclude? We can conclude that the structure of the vein is quite different from the structure of the artery. Is the vein made of the three basic layers of any blood vessel? The answer is yes. Here's an artery and here's a vein, and tunica intima is the same. Simple squamous epithelium, called what in case of blood vessels? It's called endothelium. And then we have the tunica media. The tunica media is the thickest layer in the wall of arteries, but in case of the veins, it is not as thick as that of the arteries. And tunica adventitia is thin in arteries, but it is the thickest in the veins, because the veins, they want to dilate, and when they dilate, they need a very specific connection to the surrounding structures provided by the tunica adventitia. This is a histological section in fatty tissue, because you can see that the fat, the white cells with peripheral nuclei is the fatty tissue, and here is the artery. Now, if we look at the artery, we can see that it is circular, and the tunica media is thick, and tunica adventitia is less thick. When we go and look at the vein, first of all, the vein are collapsible structure. They can collapse, and we can see that the lumen of the accompanying vein to the artery is much larger, and the tunica media is thinner, while tunica adventitia, in relation to the size of the vein, it is thicker than that of the artery. Although you may say, well, I can see it is thinner, but if you have a cross-section of the wall of the artery, you can see that the tunica media is the thickest, and go to the vein and compare which is thicker, the tunica media or tunica adventitia. You will find that tunica adventitia is thicker than tunica media. This is a good slide to test your understanding of what we have said, and you can see that this is an artery, and the tunics, 3 tunics, are numbered 1, 2, and 3. Then you go to your right and you can see the vein, and you can compare the different structures between arteries and veins. The question now is, are veins of equal size all over the body? The answer is no. They start as small veins called venule on your right, and then they collect the venules and they form a middle-sized vein, where you can see that there is change of arrangement of layers. Now we are going to have some smooth muscles, 2 or 3 layers, and then when middle veins collect and form a large vein, still we have 3 tunics, 3 layers, and still the tunica media, although it is made of smooth muscles, but it is not as thick as the tunica media of arteries. These are the veins of the head and neck, and in this area, which is the temporal area, we have a vein called superficial temporal vein that comes down and it runs in company with the superficial temporal artery. Now, it is going to meet this vein, which is the maxillary vein, and it is going to form a large vein deep to the ramus of the mandible called Retromandibular Vein. So Retromandibular Vein equals the superficial temporal vein plus the maxillary vein, and this retromandibular vein is going to divide into 2 branches, an anterior and a posterior one. The posterior one is going to meet the occipital vein, and the occipital vein plus the posterior vein branch of the retromandibular will form the external jugular vein. Now, the facial vein is going to meet the anterior branch of the retromandibular vein, and they meet and they end up in the internal jugular vein. The internal jugular vein is concerned with structures inside the skull, and it runs deep to the sternomastoid muscle, and it does not receive any branch from the scalp, face, or the neck. Coming down to the lower part of the neck and upper part of the thorax, we know that this is the internal jugular vein, and the internal jugular vein is concerned about draining of the structures inside the skull. And we have the external jugular vein. We know now how it is formed, and they come down and they want to go to the right atrium. How are they going to go to the right atrium? Here is an artery coming from the axilla, draining the upper limb, called the axillary vein. Sorry if I said an artery. Then, as this vein crosses the first rib, it becomes the subclavian vein, and subclavian vein is underneath the clavicle, and it goes medially, and it is going to receive the internal jugular vein, and these two, subclavian plus the internal jugular vein, they are going to form the brachiocephalic vein. Leaving the lower part of the neck and getting into the superior mediastinum, this is going to be the situation. This is the subclavian vein joined by the internal jugular vein and forming the brachiocephalic vein. This is on the right side. The same thing is going to happen on the left, and this is the internal jugular vein on the left side, and this is the subclavian on the left, and they meet and they form a brachiocephalic vein, a left brachiocephalic vein. Now, how many brachiocephalic veins do we have? The answer is 2, one on the right and one on the left. And are they of equal length? The answer is no. The right is shorter and the left is longer. Now, when these two brachiocephalic veins unite, they form the superior vena cava, which is going to enter the right atrium. Looking at the venous drainage of the upper limb, we are going to see something new. Veins of the upper limb, as well as those of the lower limb, are divided into 2 systems, a deep system and a superficial system. The deep system runs with the arteries supplying the upper limb, and the superficial system is under the skin, and they are usually visible. So, the deep system, if we have a radial artery, then accompanies it is the radial vein, and the same situation is in case of ulnar artery, ulnar nerve, deep between muscles, and these veins will unite to form the brachial vein, accompanying the brachial artery, and these system of deep veins, they will end up in the axillary vein, the vein in the axilla, accompanying the axillary artery. Now that is the deep system. Then we have a superficial system. This superficial system is made of, on the lateral side, of a vein called cephalic vein. This goes up into the arm, and the cephalic vein is going to end up in the axillary vein. On the medial side, we have the medial part of the superficial system, which is called the basilic vein. And this basilic vein, as it comes up into the axilla, it is on the medial side and on the medial side of the arm, and this is not going to join the axillary vein. It is going to join the brachial vein. Here we have a situation where inferiorly we have the forearm and superiorly we have the arm, and we can see that this is the cephalic vein, and on the medial side we have the basilic vein, but in front of the cubital fossa we have a vein connecting these two superficial veins, and this vein is going to receive a name that is descriptive of its position. It is called the anterior median cubital vein. It is in front of the cubital fossa and it is anterior. This vein is mostly used to put needles into it for aspiration of blood or for giving intravenous fluids. Going down to the lower limb, does the lower limb have superficial and deep system? The answer is yes. What about the deep system? The deep system is going to follow the deep arteries, and therefore we will have an arterial arch at the dorsum of the foot, and of course there is a venous arch accompanying the arterial one. Then we have posterior tibial artery, we have posterior tibial vein, and anterior tibial artery, and we have anterior tibial vein. And then these two, anterior and posterior arteries, are a branch of the popliteal artery, and there is a popliteal vein which is going to go up accompanying the femoral artery, and this is the femoral vein. Now we are finished with the deep system, and we will have a look at superficial system of veins of the lower limb. Now, to start with, we go to the venous arches of the foot accompanying the arterial ones, and on the medial side, anterior to the medial malleolus, you can see that vein in your foot and ankle joint, and this vein is going under the skin superficially, and it goes up to the inguinal region, but this vein has connections to the deep veins. They are called communicator veins, and they are guarded by valves. So when muscles contract and the deep veins push blood up, it will create a kind of pressure that takes blood from the superficial system into the deep to push it up. If this communicating veins loses their valves, then blood will come from the deep system into the superficial system, and the person has a varicose veins. Then, as it goes on the medial side of the leg, it goes medial to the knee joint, and then medial to the thigh and slightly anterior, and ends up in the femoral vein. The second component of the superficial venous system of the lower limb is called the short sappiness, and starts on the lateral side posterior to the lateral malleolus and goes up in the posterior part of the leg, and it is going to end up in the popliteal vein. Now the joint of the long sappiness with the femoral is guarded by a valve, very important valve, in addition to the communicators below. And in case of the short sappiness, there is a valve between it and the popliteal vein, and this is an important vein valve. Here is another image showing the short sappiness or the lesser sappiness vein as it starts posterior to lateral malleolus and goes up on the posterior surface of the leg, and then it is going to enter the popliteal vein where it has a guarding valve. This is lesser sappiness or the small sappiness vein. The veins of the lower limb at the end of the day, whether they are superficial or deep, they end up into the femoral vein. Especially this vein on the medial side, which is a superficial vein called the long sappiness vein, also called the great sappiness vein. This sappiness vein is going to join the femoral vein, and this femoral vein under the inguinal ligament is still the femoral vein, but as it goes up deep to the inguinal ligament, it is going to be called the external iliac vein. You can see that these veins accompany arteries, and you know the arteries. The external iliac artery is the artery coming to the lower limb, and the external iliac vein is bringing blood from the lower limb. This is a view of the posterior part of the abdomen, showing the different veins. Let's start with the inferior vena cava, which is the central large vein bringing venous blood from all parts below the diaphragm. The beginning is the external iliac vein draining the lower limb. Then we have the internal iliac vein draining the organs in the pelvis. These two veins will join and will form the common iliac vein, accompanying, of course, the common iliac artery. Now, the inferior vena cava is starting at the point of joining the two common iliac veins, and it goes up towards the diaphragm. We are going to see lateral branches on both sides, and these are called iliolumbar veins draining the lateral and posterior abdominal walls. These veins are going to join and form an ascending iliolumbar vein, which is going to enter the thorax, and it is going to create another system of veins. Then we have the renal veins, one on the right and one on the left. They don't join at a comparable point, but the left is usually higher, underlined usually, and they join at right angles, just like the renal arteries when they branch out of the aorta at right angles. Then we have the structure inside this circle. This is the gonadal vein, the right one, whether it is an ovary or a testis. And then on the left we have the left gonadal vein, which is not going to join the inferior vena cava. It is going to join the longer left renal vein. And just under the diaphragm, hepatic veins are going to join the inferior vena cava, and of course we are going to see veins on the abdominal surface of the diaphragm joining the uppermost part of the inferior vena cava. As we go up above the diaphragm, we have veins that come from the inferior vena cava and end up into the superior vena cava, bypassing the heart. So the blood in this group of veins, it does not end up in the inferior vena cava, but it ends up in the superior vena cava. Now, this vein on the right is the Azygos Vein. It is going to originate from the right iliolumbar veins as an ascending branch, and then passes through the diaphragm, and as it is on the right side of the vertebral column, it is going to collect veins from intercostal spaces, veins from the esophagus, and higher up veins from the trachea, and then it arches and opens into the superior vena cava. This is the Azygos vein. Then on the left we have what is called Hemiazygos Vein. It has the same origin of the Azygos vein, but it is shorter in the thorax, and it has almost similar tributaries or branches like the Azygos vein, but it is ending and it is shorter than Azygos vein. Then we have this point marked by this arrow. This is where the Hemiazygos vein ends, and it is going to communicate with the azygos. And then we have an accessory Hemiazygos vein running a longer distance on the left side of the chest, on the lateral part of the vertebral column, collecting veins from intercostal spaces, the trachea and the esophagus, and it is going down to the point where the Hemiazygos vein ends, and both these veins, they are connected to the azygos vein on the right side. It is going to join the superior mesenteric vein and form the portal vein. Now, what is the portal vein made of? Number one is superior mesenteric vein. Number two, a vein which is formed by union of inferior mesenteric and splenic. The vein coming from the spleen, they form a vein that will join the superior mesenteric vein and form the portal vein, which is going into the liver.